Well, February is Heart Month, so today we're focusing on women's heart health. And heart disease is the leading cause of death for women, and yet many of us are unaware of this threat. Cardiologist Dr. Katherine Kavanagh is here now to outline the risks unique to women and what they can do about them. Good morning to you, Dr. Kavanagh.
Good morning.
Thank you so much for being here on this crazy morning.
We picked a worse morning.
We did. Why don't we start with some of those risk factors? Because I don't think a lot of women even understand what their risks might be for heart disease.
Okay. Risk factors, I think they're very common. We've heard about those. Smoking, which is one we can do something about. Obesity, which is something we can do something about.
Sure.
Cholesterol, sometimes you can do something about that, but genetics determine it a lot of the time, but keeping it under control. Hypertension, which needs to be kept under control. All of those are risk factors.
Right. And so many of us have one of those risk factors and may not even realize that that puts us at risk for heart disease.
That's right.
I also like to talk at this time of year about the real difference between women and men when it comes to heart disease, because a lot of our knowledge about heart disease is based on men. But you're saying women actually are very different in heart disease. Tell us a little bit about that.
They can be very, very different. There's, if you think of going to Vancouver and the different ways you could get there, you could drive, you could fly, you could take the train.
Sure.
Okay? When it comes to a myocardial infarction, what the infarction means is a heart attack, and there's damage to the muscle and the tissue. How that happens can be different in men and women, and especially younger women. Younger women can have heart attacks, but the mechanism is very different from the older person, the older woman, and very different from the male.
Okay.
And young women don't expect to have heart attacks.
Sure.
And often when they go to see their doctor, they may not expect them to have heart attacks, because we now know the mechanism is different.
Sure.
In young women, we sometimes see a dissection of the coronary artery. And that can be, we can see that around the postpartum time or peripartum time. Birth control may be a factor. Some of the inflammatory diseases like lupus can be a factor. The type of plaque and how it erodes rather than, it can be just the surfaces of it changes, so that when you do an angiogram like we frequently do, the vessel may not look occluded. Oh. But it has eroded and allows a clot to form rather than rupture, which is what we see in men and older women. So the mechanisms are different. The result is still the same.
It's still the same. Wow.
Still the same.
Can we talk a little bit about even some of those symptoms that you talk about?
These different mechanisms may explain the symptoms. We're used to hearing the crushing chest pain, and that will drive the person to the physician right away or to the emergency.
Right.
But sometimes it's not so clear cut. There's a waxing and waning, and maybe it's some back pain, some jaw pain, some shortness of breath, or some fatigue.
Wow, that is very vague. You can see why women might not even pay attention to that.
That's right.
Because we've talked about this as well, that women are often so distracted. You know, they're often caring for everybody else before they're actually taking a look at what they're experiencing.
Lots of multitasking, trying to get it done.
That's right. What do women really need to know when it comes to heart disease in terms of looking after themselves?
They need to take, one of the things that always struck me is that you have to take time to be healthy. You have to make time to be healthy, because you will certainly make time to be ill.
Right.
You won't have any choice in that. Right. So it's important to look after yourself. Make those trips to the doctor. Make sure your blood pressure is under control. Make sure your cholesterol is under control. And if you are having unusual symptoms, check it out. Realize that there's something different. Know what your general state of health is, and this is not right. I'm not feeling right. What's causing this?
Right.
It's not common in younger people, younger women, but it can happen.
But it can happen. And that might be something, too, to even articulate to your family physician. Could it be heart disease? Could this be something related to my heart?
Yeah. Often a question that I ask that I find very useful is that, are you able to do the same things that you could do, say, 6 months ago? Because if it's causing some non-specific symptom, all of a sudden you might be not doing that. You mightn't be exercising as much. You mightn't go up and down stairs quite as much. What is it you're not doing now that you couldn't do before?
Wonderful. Okay, so really pay attention to yourself and not just everybody else.
That's right.
Wonderful. So many good things we've learned today. Thank you so much, Dr. Kavanagh.
You're quite welcome.